Many of you girls and women out there would have this question: why am I in pain? Does everybody get this period pain? Am I the only one who takes off from the work so the entire workplace knows I am on a period? Why am I not conceiving? My cousin who got married after me has got 2 children. Is it me? Is it my husband? Anybody who has these questions, girls and ladies, you are the one to watch this video for getting the right answers and getting the right direction towards betterment. Hello everyone, welcome to this new episode of wanting to know what is actually wrong with your body. Did you know 1 in 10 women do suffer from severe pain during periods? They suffer from lower tummy pain throughout the monthly cycle and also have difficulty in conceiving later on. I am Dr. Meera Raghavan, consultant urogynecologist and robotic surgeon, now here with you to understand what this condition could be, what can be done about it, and why does it happen in the first place. Let's listen to this and enlighten ourselves. As I said earlier, 1 in 10 women do suffer from cyclical pain, non-cyclical pain, which doesn't coincide with their menstrual cycle, and also have difficulty in conceiving. Have you ever heard this term endometriosis? I'm sure most of you would have done. Some might be wondering what this jargon is. Others might be scared to even hear that word because you might have had traumatic experience about going through the whole thing. Endometriosis is a very common condition which affects women of all ages, whereby the lining within the womb is not only found within the womb but is found in places where it is not supposed to be. So it's found on top of the tubes, top of the ovaries, the cling film like lining within your tummy cavity, what we call peritoneum. It can get adherent to the tubes which connect the kidney and the bladder, or on top of the urinary bladder, or on parts of the intestine and the large intestine. So you can imagine what kind of impact and suffering that could actually cause. So let's now become Sherlock Holmes of our own body to find out what possibly could be pointing out to this dreaded condition of endometriosis. Women, when they suffer from severe pain during periods, it's not something to be brushed under the carpet. You can have in common pain on the first day, maximum on the second day. If the pain starts well before your period, at least a week prior, or continues well into the 7th day or the 8th day of the period and again resurfaces after a week, this is not something to be brushed aside and ignored. You could be harboring this condition called endometriosis, and that is the reason the pain comes back in such severity. What other symptoms could be the pointers? As I said, let's become our Sherlock Holmes. You could have burning or painful urination, and it could sting while you're peeing. So all that burns is not urinary tract infection. You can even notice blood in urine during the menstrual cycle. There can be pain when you are actually passing stools. It could be excruciating, and the whole episode can be so traumatic you do not know what to do at that time. Many people complain that they feel a very strong sensation of something heavy or pulling down below, as if you're sat on a rock, and they need to use heat pads or lie down most of the time, and it does affect fertility. And many women find this out in the first place because they're totally asymptomatic and they do not have any pain, but definitely end up having difficulty in conceiving, especially after 2-3 years of being together with the partners. So it causes a myriad of symptoms, from painful periods, pain during the entire month, pain during intimate contact and sexual intercourse, pain during urination, pain during passing motion, and difficulty in conceiving. And not but the least, it also can cause heavy irregular periods. Such is the dreaded symptoms of endometriosis. It's not all doom and gloom if somebody finds out that they have these symptoms. You do have wonderful investigations and evaluation methods to give you the correct pathway of treatment. So we do analyze your symptoms and possibly understand that you could be suffering from endometriosis. The first step which we do is an ultrasound imaging. In younger adults who have never been pregnant or sexually active, a pelvic scan done through the abdomen is sufficient enough to find out the presence of any cyst or any congenital malformation of the uterine system itself. Nowadays, we do have a 3D scan which pretty much anatomically reconstructs the entire pelvis and gives us a clear understanding of what is normal and what is abnormal and the relationship to the neighboring organs as well. A classical gold standard investigation is what we call a transvaginal ultrasound, which is an ultrasound through the natural pathway of the vagina, which kind of gives us a closer look and a glimpse on the uterus, the ovaries, the tubes, the neighboring organs, and the relationship of the uterus to the bladder, the rectum. And when we move the uterus with the probe in the vagina, it can be painful. It can pick up nodules at the back of the uterus which are stuck, or if the other organs tend to move with the uterus, it shows that they are stuck with the uterus because of the inflammation given off by the endometriosis. Such is the precise value of transvaginal ultrasound. In case we are planning any intervention, we go on to do what is called a MRI. MRI can give us further details about tissue thickening, whether it is scarred, whether it is stuck to other pelvic organs, especially the tubes connecting the kidney and the bladder, what we call ureter. Now, ureter is a dangerous, quiet standby spectator for the entire enigma of endometriosis. There are no symptoms, but the scarring which happens and the tethering which happens in the cling film like cavity lining which I mentioned, which we call peritoneum, the scarring kind of strangulates the ureter, causes a blockage, and whereby the kidneys face the back pressure of urine, can lead on to kidney damage and permanent kidney failure. Unfortunately, this can happen in young women, and an MRI and evaluation of the upper renal tract helps us find out whether the kidney are safe, whether there's any back pressure, whether there is any kidney damage at all, and then we could secure the kidney and make sure we salvage it for better functioning. So never ignore symptoms of endometriosis, get it evaluated so we come to the correct diagnosis, and also we can mitigate complications which can arise because of a late diagnosis.